We're happy that you're here. We are at our second month looking in on our upper healing platform. And today we have a very interesting topic lined up for you. Thank you for being here and thank you for all those whom you invited. Of course, this session is being recorded and it will be posted on a YouTube channel where you would be able to access it. That's a YouTube channel for Upper TT, Adventist Health Professional Association. And so let's get into our segment at this time with a word of prayer. Heavenly Father, we give you thanks for our meeting today. We ask for your continued presence to be with us, even now in our discussion. We pray that it would be beneficial to someone in need and that many lives would be blessed and improved for the information that they're about to receive. We ask for your continued grace to be with us, be with all those who are yet to join. This is our prayer in Jesus' name. Amen. Right. So thank you again. Welcome, welcome. Exercise is medicine, and we are looking at moving toward lifelong health. Moving toward lifelong health. You know, it's one thing when you are young, you're busy, up and down, engaged in so many activities. And many times individuals would say to me, I used to be quite active. I used to play football. I used to be in tennis. I used to be cycling. And then I stopped and the situation started to decline from there. And so I would say to such individuals, go back to being active, go back to being physically engaged, take on some new activity. And when they do, make some adjustments to their lifestyle, in addition to a healthy diet, it really makes a difference for them. And so we tend to take exercise and movement for granted, but our goal this evening is to share its importance, its value, and even how it can be considered as your new medicine if you've not yet been looking at it in that manner. So I am Dr. Natalie Nash. I'm a naturopathic doctor, and I'm also the president of Upper Trinidad. I'm also the managing director for True Health Lifestyle Center, located in Trinidad. Just a disclaimer, as we get into this presentation, the information presented in this lecture is intended for educational and informational purposes only. It is not intended to diagnose, treat, cure, or prevent any disease, nor is it a substitute for professional medical advice, diagnosis, or treatment. Participants are encouraged to consult with their physician or qualified health care provider before beginning any new exercise program, particularly if they have existing medical conditions, if you're pregnant, recovering from illness or injury, or currently taking medication. Our focus today is on exercise. Therefore, exercise recommendations should be individualized according to personal health status, physical limitations, and medical guidance. Your safety is a priority and always begin gradually. Listen to your body. If you feel a pain, don't just be pushing. It may be that your body is not ready for that particular activity, and seek professional guidance when necessary. So we're looking at, you're hearing terms like physical activity and exercise and so forth. So I have a question for you. And I want you to respond. You could unmute or you could actually, respond in the chat. Now, first question, do you believe that physical activity is important. Do you believe that physical activity is very important? I'll classify my importance. Very
Yes.
important. Okay, you're
Yes.
saying yes,
Yes.
right? Yes. Okay, great. And to the one who voiced, would you like to share why are you so passionate with the yes believer of the yes? All right, sorry if I put you on the spot, but why do you think it's so important? Anyone?
It helps with the blood circulation in our bodies.
Mm-hmm. And that is important. Yeah. If the blood doesn't get to certain areas, it can cause a lot of problems. So yeah, I think we are most someone else wants to speak.
Well,
Yes.
blood
Also,
is
not only with blood circulation, it helps with the oxygenation of the body to move the oxygen throughout the body and through all the tissues and organs.
Yes, very good.
So
Yeah,
from primary school, I learned it was one of the laws of health because it strengthens the body.
good. Wonderful. Thank you. So we're going to look at just a few definitions because these terms will show up in our discussion. So physical activity is any movement of the body. I mean, even babies move in the womb, and when they come out, you lay them in the bed and they move and they would be so wiggly, I call them. So any movement of the body performed through the skeletal muscle contraction that results in energy expenditure above the baseline. So you're not just sitting quiet, you're moving. So, like right now, I'm talking to you and I'm moving my hands, I'm moving my mouth, I'm moving my body. That's movement. All right. So, physical activity. But here comes exercise. Exercise is a subcategory of physical activity. It is planned, structured, repetitive, and purposeful. Planned, structured, repetitive, and it's done with a purpose. And it's done with the intent of improving or maintaining physical fitness, physical performance, or health as the objective. Now, note this, not all physical activity is exercise. Yep, not all physical activity is exercise. You could be sweeping the floor, and this is very important because many times I'd say to individuals, you need to exercise. And they would say, but I'm busy. When the day comes, when the night comes, I'm tired. And in the day, I'm busy. I'm cleaning house, I'm washing, I'm cooking, I'm hanging out clothes, I'm out in the garden. I'm just busy moving. So to go and exercise on top of that, that seems like a tall order for them. So I want to let everyone know, stop and think. Not every bit of physical activity is actually exercise. Is it increasing your heart rate? Is it keeping you in with that consistent, repetitive movement that can improve the health of the body? Then, if not, then that's going to be a problem. Now, yes, this is being recorded. Yeah. We are created to move and to be active. That's right. So we want to look at some components of exercise. How some components of exercise. So aerobic endurance exercise that will entail cardiovascular uh, movement there. And so that's one category, aerobic or endurance. The second one is strength or resistance exercise. And like you see the man here, he's like doing all that strength. And then you got flexibility, you got balance, and balance is very important, especially as we get older. You see that older individuals, senior individuals, need to have proper balance, or else they will feel quite shaky. And there are times when I would say you need a cane or you need a walker for that support, so that you may be moving, but you're quite weak. And so you need that walker for support to move your body and to give you that balance that you need, so that the individual would prevent falling. Falling is so worse than, walking and you're thinking, well, I don't need a walker. Because many times individuals would say, I don't need a walker, I don't want one. And not recognizing its value. It's really a support. Now, looking at each of them, aerobic or endurance exercise is rhythmic movement of the large muscle groups. You're looking at your arms and your legs. So even if you are walking, try and swing the arms. Don't just hold yourself and fold your arms and you're walking. You're walking, you want to swing the arms, movement, left and right, swing the arms. Aerobic is sustained over time, and the more you do it, the stronger you become. There's so many individuals that come to our lifestyle center quite weak, and they would just be able to walk 100 yards barely. And they will do that slowly, taking their time to do it. And that's it. Day one. They do the same thing. However, as repeated times through the day that they do that, what is happening? The body is beginning to gain strength. That blood is moving. That bone is being impacted. And that rhythm is being formed. And the brain starts to pick up and say, but I can do this and more. So within a couple of days, you see that they set new boundaries, new target to get to, and they start going out and going further and further. And before you know it, in about 2 weeks' time, they're going the distance like everyone else. In 3-4 weeks' time, they're even covering more ground where they did not start off there. They started off just being able to do 100 yards, but now they're able to do a mile and more. So the body can be trained to do this. And many times individuals, when they're not well, they tend to think, well, I can't walk, or I'm too weak to walk, or I don't feel like walking. And so if you're working with individuals, you can accompany them, and that helps a lot mentally to get them out into that space of movement. So if you accompany them, but be consistent with it, keep doing it every day, every morning, every evening, and that can help. One of the things that we do is not only walk at those special times of focused exercise, but we walk after every meal. So people would say that when they come here, they walk like 4 times in a day. It's because they walk in the morning, after breakfast, they walk again, after lunch, they walk, and in the afternoon, they take a walk again. So after the meal, you find that if you were to do a walk, that movement, it's called a digestive walk or a digestive stroll. It's more casual. It's not as vigorous. It's not that brisk movement, but it's a casual walk that can help to aid and support digestion. So examples of aerobic exercise will be like walking, cycling, swimming. All of those are examples. So just last week, over the weekend, we had a group here and we were doing some activity. Apart from walking on the ground, we were working out in the water. And this is what they were doing for one. Okay, So when you're vigorously doing that for quite a while, you're working up all those arms, you're keeping your ground steady with your legs. And, so this was just one of the activities. They got some workout there in that water that, they were like, oh, really breathing, getting all that heart movement, get a heart rhythm going. Okay, so as you do aerobic exercises, the benefits will be to lower the risk of all-cause mortality. What does that mean? Is that death can take place, and I have a little nice one coming up to show you, that individuals can be, individuals can actually have premature death, but aerobic exercises tend to ward off that and to lower the risk for death and dying, and it's from many varied causes. So it can also help to reduce cardiovascular disease and stroke as you keep that blood moving. Most times the blood is thick. What happens when individuals are laid up in bed in a hospital? They tend to give them blood thinners. And that can cause, them to keep the blood thin to prevent blood clots. And that's why they would be interested in individuals getting up and walking and moving after a surgery or just being admitted to the hospital. You can't lay in bed all the time, but do people do that in their homes? Yes, they do. So it's when we understand why we need to get up and move, then that can make a difference. It can also, aerobic exercise can lower your risk for multiple cancers. It can improve your sleep quality. It can enhance your quality of life, and it can help to better control your weight. So when it comes to sleep, tire yourself in the day. Keep moving, and in the evening time, you'll be like so tired, you don't want to sleep. When it comes to cancer, if the blood is stagnated and not circulating, if the immune system is not stimulated because of the movement, then cancer states can develop in the body. Now, Proverbs chapter 4, verse 23 says, keep your heart with all diligence, for out of it springs the issues of life. So even the Lord is interested that we keep our heart, our mind, but even our physical heart. Let's keep it going strong. And even the movements, aerobic exercise tends to strengthen the heart. The heart is a muscle. And as we move it, get it exercise. How do we do that? By our movement. It keeps beating and have a nice strong beat. There's some people where medically they look at them and their heartbeat is weak, it's low. So if you want a nice, strong, robust beat, and that can keep you in good form. Now, another type of exercise is strength or resistance training. And here is where the muscles contract against resistance. And so you want to be able to do some strength. You can even sit with your family member and do some, what you call this, the hand strength exercise, where I'm holding your hand, you're holding mine, and I'm trying to push yours down and you're trying to push mine down. So you can do that. That's fun. And then you can also build lean muscle mass. As you see the lady here building her muscle, just 2 little dumbbells that you can have. But the thing is with the dumbbells, you soon outgrow your strength. It increases over time. And so if you had like a 5 pound, that might feel so light to you after what you might want an 8 pound. So if you get a nice set of dumbbells, you can work through that and build up. Now, it also helps to improve strength and endurance. And to be strong, to do these strength-bearing exercises is important. It helps individuals to feel so more confident that they're able to do certain tasks on their own without seeking help. It is quite empowering for individuals. So we can get some strength, endurance in the water as well. So look at this. You see, so these are like dumbbells. They're quite light. They can literally float. But when you run them under the water, you get resistance. And so you literally have to like hold, and that could give you a little nice muscle tone. So you get resistance with it. And so they're great. You don't even have to have a pool. If you have the sea, the ocean near you, you can even do this quite well. All right, so benefits of resistance training. We want to understand that it can have the impact it has is increased muscle strength and endurance, higher basal metabolic rate, and so your metabolism sort of is bumped up. You're not as feeling fatigued, and so it can reduce body fat, improved cholesterol and glucose levels, reduce arthritis pain, lower the risk of falls in the elderly. This is super important to lower your risk of falling. Many times as elderlies, if they don't build their strength and they fall, hip fractures, that's quite common in the elderly. Not only are you looking at preventing falling, but even strengthening and building your bone density as you do this resistance training. And you're looking at improved mental health, reduce lower back pain. Again, if your upper body is stronger, then you can bear the load on your waistline, that lower back. Improve bone mineral density, especially in postmenopausal women, and then reduced fatty liver disease in sedentary adults. These are some wide health challenges that faced our adult population that can be of great interest. So strength and resistance training seems to be very important. Now, flexibility, where we are looking at the range of motion at the joints, and it is specific to each of those joints. And we're also looking at, just to say, it's the flexibility exercise. It's influenced by muscle and tendon and ligament tightness. And benefits of flexibility training is where you find increased muscle length and joint range of motion. So as you saw the man stretching there, stretching his leg on the heel, and all the tendons and everything there is being stretched, maintaining this length. And that's important. Many times as individuals get older, they tend to seem like they're getting shorter. And it's literally, that's what's happening. One, you're losing cartilage in between your vertebrae, but you're also you're not moving your body as you should. So you find that the length of your varied parts of the body can shift and be reduced. So you can do these things. He's also tilting a little bit forward. So improved walking stride in older adults. So it's not just like walking in a shuffle way. Your stride is really nicely formed. Better collagen alignment in healing is tissues. So if you injured yourself, your tissues can be repaired, and or surgery, you need repairing and healing well. And then reduce stiffness and tightness. Think and take a mental raise hand. How many individuals know someone who wake up in the morning with stiffness and with tightness in the hands, in the feet, you know? Yeah, someone raised hand. Good. Yeah, it's quite common. So how can we prevent that? If the day before you actually engage in all these physical activities and stretching, especially if you hurt yourself, Like last year, my mom fell and broke her wrist. And there again, the importance of being senior, lifting and going, lifting these heavy weights to build bone density. So she broke her wrist, but in her physiotherapy, she will have all these different activities to do. And if it is that she didn't do all the flexibility, the stretching of the fingers and all of those things, if she didn't do it or do it enough, on mornings she would wake up and it's quite stiff. So our point is, many times seniors have some injury of the past, and especially those joints and those areas of your body, you need to stretch them every day. And that's important for you to know, because if you're not doing that, then the situation progresses. And before you know it, you're not moving your body at all, as well as you should at all. Okay, then this is another one, balance. Balance helps to maintain equilibrium. It includes static and dynamic movements. Standing on one leg could be challenging. So practice, do this. When we were young, we were able to skip rope and jump on one leg and do all those things. Well, maybe in time to come, we're not able to do that now, but at least just to stand on one leg and you count like 12 seconds. And look, you're not even holding on to something. It will require practice. It will require retraining your body if you're not able to do this, but it can happen. Then walking backward. Just take your time, walk backward without falling. And that's another practice habit. So balance training is important. Why? It can improve stability and coordination. There are times when people tend to trip up and fall and hurt themselves. So as the brain, to maintain that coordination from your brain tells your body to move, and it's moving. The practice of it every day, every week at least. And then it reduces fall risk significantly, especially in our older population, preventing injuries from falls, including fractures, and it enhances physical confidence that I'm able to move, I'm able to make and do my errands on my own, and I'm able to do many things. So balance is quite important, maintaining that balance. So here is one, a sedentary lifestyle, which is opposite to all of that physical active person. And there are individuals who do live a sedentary lifestyle, and you do not need to be in your senior years. A lot of our youth are in that sedentary mode. So tell me in the chat or voice, what are some ways in which we can be sedentary? Let's see, what are some ways that we can be sedentary?
Watching TV for long periods.
Aha, very good. And statistics shows that watching TV takes a huge bulk of time. When working from home, yes.
Sitting at a desk at work for long hours.
Yes. Lying and sitting a lot. Good. And how about being in transport? You can't stand in a vehicle or in a bus, so you're sitting there for long hours. Oh, especially when there is traffic. My goodness, traffic tends to keep us sitting for very long hours. And when you come out, you feel stiff. Traveling in an airplane, excellent. That I feel like I'm on one of those game shows where you all are putting in all of your responses. Okay, video gaming. Yes, and long commute time, right? That's right. Why I laughed about the traveling for long hours. You go to England from here. or some part of the US and you have long hours or go to some Eastern countries, you're going to be flying like 30 hours altogether. So when when you travel that way, you need to get up in the airplane and move and stand up and go up on your toes, down the roll, back on your heel, up on your toes, back on your heel. Do a couple of those. You're sitting, you're flexing your feet, stretching down backward and forward. It's your legs, your hip, everything that needs movement. Okay, so great. Sedentary lifestyle. There, it's a hidden risk for mortality or death. This is getting serious. So it's defined as prolonged sitting or low energy activity, yeah, where independently increases disease risk and it raises your mortality risk, your risk for death and dying is increased even in those who exercise, but also have long periods of being sedentary, of being inactive. It is the greatest danger in physically inactive individuals. All right. It is the greatest danger in physically inactive individuals. As a rule of thumb, move more and sit less. Take that away with you. Move more, sit less. When you're in the office, move more, sit less. Go to people instead of calling them on the phone. Some people in the house, in your own home, we tend to do what? You want somebody in another room, some part of the house they are, and you go on the phone and you call them up and speak to them on the phone. No, get up and go to them. Now, I have a self-imposed rule in my house that nobody shouts out names around here. We're quite civilized, okay? So nobody's shouting out and calling anyone. So it's like you want somebody, you walk and you go look for them and you see them. I mean, you might be calling, looking for them, okay? But to say screaming down mommy or screaming down child's name or husband name. No, 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 no. We walk around and look for people and don't call on the phone either. Okay, so let's go. Proverbs 6:6. Go to the ant, consider her ways and be wise. Don't, the ants always move. Have you ever seen a lazy ant? An ant just sitting. You can see that with some spiders. They sit in their web and they just sit there. But they're quite busy when they build. Some of them have to build their webs every day. But the ant is always moving, doing something. So let's move more and sit less. Now, this is an interesting piece of research that I want to share with you. All right, somebody is saying reading and taxi drivers. That is so true. All our drivers for these commutes, the taxis, the bus, the maxi taxis, and they're sitting for quite a long time. And they tend to put on weight for it too. So look at this here. You can die before your time. Did you know that? You can die prematurely. So it's nothing about, oh, it was his time to go home. The Lord was ready for him. Not always. All right. So you can actually die before your time. Low cardiorespiratory fitness was the number one cause of preventable deaths from all-cause mortality among 40,842 men and 12,943 women enrolled in the Aerobics Center longitudinal study. This is a study where there were like about 80,000 people, but then they sort of narrowed it down to do this comparison here. It's about 53,000 plus. So what happened? is that they looked men and women, and they lined them up, and they saw that they died because of being physically inactive. Even though they had other conditions, it wasn't those other conditions that killed them, but the sedentary behavior, the sedentary lifestyle. And so they looked at poor cardiorespiratory fitness, smoking, hypertension. Yeah, they had high cholesterol levels. They also had diabetes. They also had obesity. But the highest number of deaths occurred amongst those who were physically inactive, who were sedentary. And so the author of the study, he said, they died prematurely because of this behavior, behavior of not moving, of just sitting, of lying down in a bed, just not moving. So we want to be able to move and not be part of that number, because imagine on your tombstone, died because of watching TV too much, or sitting too much, just there. So that's not how we need to go. All right, so keep active. To be both physically active and to reduce sedentary time, we want to be able to move at least 150 minutes per week of moderate to vigorous physical activity. That's on an average of about 30 minutes, 5 times for the week. And to reduce sedentary time, sitting no longer than 50 to 60 minutes without a 5-minute movement break. This is important. So if we're going to sit here this evening and talk, and it's going to cross an hour, we need to get up for a 5-minute break. Even if I'm still talking, you get up and start moving. I watch, even in our churches, when they say stand up, let's sing a song, kneel down, let us pray, do it. Because in that way, you wouldn't be sitting for 3 hours. All right, so get up and move and get up and move. When anywhere you're at, try as much as possible. Have a 5-minute break when you're for 1 hour sitting. How much is enough? We just had some recommendations there. And this is another chart where they actually looked at years gained when you moved. That instead of regressing and dying off, you can actually add more years to your life when you move. Walking and running, and they compared both of them and saw that individuals, if they gave, and so the more you give, the more you will get. The more you give into walking and physical activity, the more you will get in terms of extended life. And so here, if they walked for about 200 minutes per week, that's more than 150. So if even though the American Sports Society, they would recommend 150, do more. Don't think it's like the least that I could do. And I do tell people, walk at least 150 minutes per week. That's the least, but please do more. So if you did more, you can gain approximately like 3.5 years more on your life. And if you doubled that 150 by four times, make it like 600 minutes a week, you can actually increase your lifespan by 100 and by 4.5 years. Similarly here, the more you walked, the higher your risk of staying alive as opposed to dying off. And so here it's like written 75 minutes of brisk walking per week. How much, sometimes people would say that they're walking just like 3 times for the week. I would say clearly that's not enough, especially seeing all of this data. That is not enough. It's not. And so you need to do more for improved health. And also, so if you just did like 75 minutes of walking in a week, 1.8 years of extended life. If you did 90 to 150 minutes per week, you had 2.5 years of life gained. If you did 500 minutes per week, what is 500 minutes? Let's see. 500 divided by 60. Wow. That's like 8 hours in a week. So that means that every day you're covering at least an hour and some more. If you were to do that, you can extend your life by 4.5 years more. Doesn't that sound inviting? All right. So when you have your exercise, you're actually strengthening so many parts of your body, your bone, your gut health. A lot of people are concerned about their gut health. And so you can eat all the fermented foods. You can do all the probiotics. You can eat all the green leafy you want. It will not work as great as if you moved, as if you walked. So you need to walk and get that movement. Everybody needs to do it in order to have improved gut health. Many people are constipated. So apart from changing up the diet and having more fiber in the diet, we need to walk to get that bowel movement moving. And when you do, it's going to make a difference for you, especially if you even get onto that rebounder, you shake up everything. And what needs to come down will come down. So all the cardiometabolic tissues like your heart, your body fat, your endocrine system, such as your pancreas, your liver, your muscles and your tissues and so forth, your nervous system, depression, dementia, Parkinson's, Alzheimer's disease. Exercise is crucially important, and exercise can be prescribed as medicine, even in those mental health challenges or brain challenges. People want to improve on their memory, walk, and that would work well for you. You're studying, you need to have some form of movement and structured exercise within your day, and then improve your immune system. If you think you're getting all these colds and flus and everything, start walking, and it makes a whole world of a difference for you. I just want to interject, even our ladies with hormonal imbalance into menopause, you've got to be moving. Or even in your menstrual cycle, reproductive years, hormonal imbalance. If you were to walk, drink more water, get sleep on time, eat a healthy diet, get sunlight, you in 1 month's time, you would see a remarkable change in an improvement in your hormones and how it responds. All those ladies getting all the pains on a monthly time, you need to start doing all of these nice helpful things, and it's going to go away from you. So there's something called health span. So even though we live long, we still want to be in that healthy phase in our lives. Okay. Okay, so one question. What is your advice to retirees who stop working at 60 years when everything stops? Everything stops at that time. How many steps would you try to do per day? Okay, so I'll take that one. How many steps you'll try to do? I don't know. Some people you can get within half an hour, you could possibly make like about 3,000 plus steps. So if you did 1 hour, you can get 6,000 plus, maybe near 7,000 steps if you did 1 hour. Some people do more than that within a day. I have people who would tell me they'll do 10, who would do 15,000, who would do 20,000 steps in a day. That could be a little quite much, and you may not have the time to do it. One of the things that I tell individuals, you have where like on a weekend. Some people will do a whole lot of physical or exercise on a weekend, and then during the week, very little, next to nothing. That is as bad as being sedentary. Okay, so we need the repetition daily. Now, when you move with exercise, it tends to benefit the body for a minimum of about 24 hours. All right, because you can do it repeatedly for quite a while and then you start stopping. What happens? You begin to regress. So at least 24 hours, you're getting benefit. And so you need to top up again every 24 hours. You need to top up in order to keep and maintain these healthy states that we're talking about. When we're physically active, it improves I'm coming to the senior question just now because it's coming in the slide. We improve our cardiovascular fitness, that you're able to walk on the mountain without being breathless. You're able to go up a step without being breathless. And so the movement can help you to attain that. If you haven't been moving today, you begin starting to do that tomorrow. You might feel like you're breathless along the way. Don't push yourself too hard, but just be consistent. And in a week's time, it's going to ease. And all of that is going to go away. And what you thought was challenging on day one, you can very well do it in time to come with ease. So you lower your risk of high blood pressure, cardiovascular disease, type 2 diabetes, breast and colon cancer, depression, falling. You get better weight management, reduce anxiety, improving your mood and cognitive function, and self-esteem is improved. There's something called FIT, frequency, intensity, time, and type. So how often are you, and this is a question you can ask yourself, how often am I having movement and physical activity and exercise within a week? How often? Is it 3 times per week? That is not enough. Is it 5 times a week? We could do a little better because I would say we eat every day, don't we? We breathe every day, don't we? So why not move the body every day? We need it. And so the intensity, am I working out hard in my sessions? Is it light? Is it moderate? Is it vigorous? What's the level of the intensity of my training? And so you may start off light, but if you're consistent, you soon would move up to moderate where we want you to be in order to make all of these nice improvements. And then the time. What is the duration of time that I'm investing in my exercise on a daily basis? And if you saw the times we gave just now, if you give little, you get little benefit. If you give some more, you get more benefit. There is a threshold where if you did too much, you're kind of like overtraining, and then you start to get a decline in your immune system. It's not being as robust and strong, so you tend to, once you overtrain, you tend to go on a decline. But then the type of exercise that you're engaged in, is it aerobic, strength, balance, flexibility, and the volume of training load per week or the month over time, you add up and see how much of that time you're really investing in there. Now, low intensity, how can we know if your activity is low intensity, moderate, or vigorous? So low intensity is where you can sing while exercising. Come, Christian, join to sing. Or we're onward, Christian soldiers, you're marching and you're walking. If you can sing all the opera and everything when you're walking while you are strolling, and so that's pretty low intense. Then moderate is where you can talk while you're exercising, but not sing. All right, so you're with somebody, you're able to talk. Maybe you have earplugs and you're talking to someone while you're moving. That's moderate. But vigorous, you would not be able to talk while you're exercising. That would be quite difficult to do. So here's the key point. If you can sing while you're exercising, that is not enough to count to make your 150 minutes at least of exercise per week. All right, you shouldn't be able to sing. If you're able to sing, you're just strolling. All right, that's not enough to bring the health benefits. So we just look at a few conditions of individuals. Let's go through this. So brain, we talked about memory being improved. Look at this. A lot of people hear about BDNF, the derived neurotrophic derived neurotrophic factor, brain-derived neurotrophic factor, BDNF, which you can get eating certain foods, vegetables, and all of those things. But in exercise, you can also get BDNF. And so when we move, that brain is being improved. I also tell individuals when you walk, you trigger the production of new brain cells in your brain. New neurons are being formed in the hippocampus. And so learning and memory can take place better. We're reducing our risk for dementia, for anxiety, depression, and enhancing our cognitive performance, enhancing our sleep quality and quality of life. First Timothy, 2 Timothy 1:7 says, "For God has not given us a spirit of fear, but of power, love, and a sound mind." How do we maintain a sound mind? Keeping that connection with God, but also through physical activity and exercise. So the weekly recommendation for children, 3 to 5 years, you want them to be engaged in play. A lot of our children today are on these game sets, on gadgets, and that is keeping them away from running around, playing in the yard. Let's take that away from them, please. It's just making their brain dull, and then they are physically inactive. So let our children play. They can play as much all day. For those 6 to 17 years old, you're looking to see, again, play movement activity of at least 60 minutes or more. Well, from the time you get into the adolescent years, they seem like to drop all games and play, but encourage them to do exercise, walking, maybe walking with their friends, and or if they engage in netball, football, cricket, whatever, support them there. It could be swimming as well. And so you want them to have at least an hour, even, so the young children, an hour and more. And including 3 days of muscle and bone strengthening, because that at that age is when their body is being formed, strengthened, all those, they're still in their growing years. So you want to build their strength. One of the things that I want us to understand too, we may be interested in walking at the end of the session, walking more, but try and get your family to be interested as well. If as a family you can go out to walk and do your exercise together, it's fantastic. As a family, you would be healthier for it. But at the same time, if your family members are not interested, don't stop and don't say, "I'm not going to go." You are responsible for your own health to move. So our children, let them play tag, running, riding their bicycle, jumping rope, climbing, building their muscle strength, push-up, gymnastic, climbing trees. Oh, some parents might be screaming if they're climbing the trees. Bone strengthening, jumping rope, and hopscotch playing, all of those things. Bring them. So here we have with the seniors. If you're over 60, 65, you're still looking for at least 150 minutes or more per week. Sometimes you may not even be able to get that, depending on the person's limitations. So you might just be able to get a little 75, which might be about 15 minutes, 5 times for the week. So if you got whatever you can get, you take. But the repetition is important. And as they repeat these movements, they would be strengthened in it. Resistance training at least 2 times per week. This is important. So, and these 2 times per week, let it be on 2 set days, and it's not consecutive days either. So if it's on a Tuesday and a Thursday, and why you have your days set is to make sure it happens, because you might say, well, I don't remember if I did strength exercises yesterday, or if I'm supposed to do it tomorrow. But if you know it's on a Tuesday and a Thursday, then it's Tuesday. So you actually launch out to start to do that as well. So we have balance training, 3+ days per week. The flexibility exercise, 2 or more. So you want a variety of movement. So it's walking, yes, but look, we want some stretching, we want some pulling, we want some weight bearing. You want to be able to have, stand up on the one leg, or if you're on two, you see the person putting the arms out here to have that balance, legs apart. All of that is improving balance, and have some supervision as well. Oh my. Yeah, this is another challenge for individuals as they get older. Sarcopenia, which is the muscle loss with age. So looking here, you see nice muscle, which is normal. And as you age, that tends to shrink and reduce. And you're wondering, where did my muscles go? And so it really goes smaller. And so that's why the strength bearing exercise is important. You can have less muscle, but the muscle mass. But if we keep building on it, then you would lose, but not as much. And some people are really scared about this part, but you don't have to lose as much. You will lose, but at least keep toned, keep the strength, and that can help you go a longer way. It declines even after age 75, even further. By the way, from the age of 30, we start losing. So you want the strength bearing exercise 2 to 5 times. When you do it, your strength declines 2 to 5 times faster than the muscle. Know that happens. So you really want to be strong, not just looking for the muscle. So even though you're slim, you're still looking for that strength to be there. If you lose your strength, it can be a predictor of disability and even death. People tend to get weaker and weaker. Weaker can mean that you start not being able to walk, that sitting even upright is challenging for you. So we want to avoid that. Look at this. Hold the handrails. They're there for a purpose, to help you on your way up. But sometimes as the strength fails and the bones become weaker, individuals tend to bend over more. So at least doing the strength bearing tends to prevent that bend over, making sure your vitamin D level is up to mark, can even help to prevent that bend over. You see this lady walking up the step gingerly. Still hold the handrails, but be sprightly about your movements. Pregnancy is another time where individuals, please don't just sit because you're pregnant. It's not a disability. It's just a change in the body shape, form. Your weight might be displaced differently. But again, 150 minutes as a starter per week. And the benefits will be reduced gestational diabetes, lower high blood pressure disorders, which tend to be challenging for individuals in their pregnancy. You can reduce excessive weight gain. Again, another challenge. Lower surgical delivery risk because you're so moving and flexible and everything. Your body might just work better for you that you do not need a cesarean and C-section. So then you have the reduced depression and postpartum depression that can take place. So exercise before, during pregnancy, and then even after delivery. Avoid contact sports, avoid activities that can increase your risk of falling, and abdominal trauma risk. Don't have anybody pelting a ball at you that can hit your belly. So then postpartum, depression can be reduced. There are some contraindications. If you're pregnant, then you may have to watch what you engage in. And you always talk to your gynecologist to see what would be best for you if you have challenges like congenital heart disease, arrhythmia, placental abruption, and all of those other things, diabetes, and preterm labor that's sort of like active and a risk for it. So not everyone would be able to do this activity, physical exercise in pregnancy, especially if you have challenges. Ask the question and make sure. Don't go doing things that can put you and your baby at risk. Weight, if you want to reduce our weight, then certainly exercise is beneficial. And to lose weight or to gain weight, we still need to exercise. There's some people who say, well, I have no weight to lose. And so they want to run away from their movement. Please don't stop doing that, because you can build muscle, you can build strength, and you can keep fit and prevent yourself from falling. You should be able to be so brisk. And many times, to your reflexes can be strengthened and improved if we were to exercise. You don't want to lose that. And so high blood pressure, more exercise can lower heart disease and the risk of stroke. So getting that movement is super important even there. And then it can reduce your risk of progression of cardiovascular disease. If you sit, your heart is a muscle, it gets no movement. It's just not going to work as robust and well for you. And then reduce risk of increased blood pressure over time. So we want that when you move, all of your organs, all of their internal structures get movement as well. Even your blood vessels. So if we want our blood vessels to be robust and strong and take and carry that blood, then let's keep moving. Here's an interesting one. Many times you take your blood pressure and the systolic blood pressure, the top number, it's elevated. Well, there can be, now if I have individuals with overly high blood pressure, I wouldn't put them to walk. I would say, sit, be calm. And when it comes down, then we can walk and move, okay? So if you are like in the 200 plus over 100 plus, you got to sit down, keep quiet. But on a daily basis, to say you have, again, we talked about medical clearance is important. And so what you can do might be light intensity. And with the repetition over time, that can be improved. So the systolic number, however, has been shown to reduce when exercise happens for individuals. And there was a meta-analysis of 391 trials. And so they were found here that exercise appeared to be as effective as antihypertensive medications, because what they did, they lined up all of the medications that individuals would take for high blood pressure, and then they looked at their blood pressure and over time, and they also looked at when they incorporated exercise, or they had a group that did exercise alone without the meds, and they did just as great as those who were on medication, and in some cases, even better than those who were on medication. So again, having a healthy body works and helps. And diabetes type 2, we're almost done here with our presentation. We're wrapping up. So diabetes type 2, where we have reduced risk of cardiovascular mortality, because having type 2 diabetes can increase your risk for stroke and heart attack. But if you exercise, you reduce your risk from those things happening. It can also help to regulate in acute intracellular glucose uptake. So helping your cells to be more insulin receptive rather than be insulin resistant. So if you have insulin resistance going on, Walking can help your cells to work better, your tissues to take up that glucose better, your cells to take it up better. It improves the function of the pancreas if it is that you needed more and better production of insulin, and it reduces the progression of the disease. So you find your HbA1c begins to improve, your blood pressure improve, your lipids, your cholesterol levels, and your BMI begins to improve. Sometimes we need to lose some body mass, and that can help. So all forms of exercise helped in this. The aerobic, the resistance, even for diabetes, resistance helped tremendously, and flexibility. Note here, have your medication adjusted once you begin an exercise program because it makes a difference. And you would need to let your doctor know that you have made some lifestyle changes, you've begun to walk. You would see that your glucose number is going to be reduced, especially the postprandial number. After you have eaten 2 hours later, you can take a check. And because you did your digestive work, it's going to be lower than if you did not. And when it comes to cancer, you can reduce your risk of breast, colon, lung, kidney, endometrial cancer, esophageal, stomach, and bladder cancers can be reduced. So we want osteoarthritis, less pain. Look at the different flexibility exercises that you need to do for that lower back pain. And to stretch those joints, improved function is benefited here. And MS, multiple sclerosis, walking can be improved once you're doing it every day, because such individuals have challenges with their gait. They have challenges, as they for their movement and so on. But if you were repeatedly doing it, you can avoid, being debilitated. So finally, if you're here today, even as a health counselor, a health provider in some form, then here are a couple pointers. Number one is that the U.S. Preventive Service Task Force encourages healthcare providers to counsel lifestyle modification for your patients with known risk factors. Especially you have these risk factors, make sure that you advise them to exercise. And if you're in a place where you can advise how much they can do. So some of the screening might include stress test or a cardio and so forth, all of those EKGs. So you might want to be doing all of that to make sure that they can tolerate and to give advice on how much they can do. But at least try and get some movement in. Like I said, whatever they can do, get it, take it, and build on that. Diet and physical activity behavioral interventions lead to consistent modest benefits across a variety of health metrics, including blood pressure, cholesterol, and adiposity, that's with weight, excessive weight. And overall counseling rates are low among primary care providers. So let's improve that. You find that for pediatrics, it's less than 50, and for more of the adult population, it's almost 60% counseling in high-risk cardiovascular patients. So we want to improve that. And what we find too, and this is statistically proven, is that as a healthcare provider, if you exercise, you're more likely to counsel your patients about it, because you will enjoy the benefits. You would say, wow, this thing really works. I'm feeling stronger. I'm feeling fit. I'm great on my energy. I'm not as sleepy. I'm sleeping better. My bowel movements are better and everything. And my body is functioning more efficiently. And then you would want that for your patients as well. And you would look at them and you would encourage them every time, and they're going to listen. Sometimes you think they're not listening, but they do. So in summary, physical activity is any skeletal muscle contraction. And so exercise is planned, structured, repetitive, and purposeful. Our goal is for this would be 300. Our goal is for 150 to 300 moderate to vigorous minutes of physical activity 2 or more times of physical activity in a week, plus 2 days of strength training. So make it, if you did 30 minutes 5 times a week, then improve that, double that, either 60 minutes 5 times a week, or spread it out throughout the 7 days. And that any physical activity is better than nothing. So this is what it has come down to. Even some of the authorities, that's what they're saying now. So it used to be that they would say, let's do 150 minutes per week at least. But they've come down to saying any bit of it we will take. So any is better than none. And so medical clearance, again, for high-risk patients. So let your commitment today be, I want to move daily. I want to strengthen weekly, move daily, strengthen weekly. That's your 2 times at least of strength-bearing exercises. Rest intentionally in between, and trust completely in our Heavenly Father. Trust God that He's going to take care of us. Trust His method of preserving health, maintaining health, and achieving health. Trust it. If we did nothing else but just got up tomorrow morning and walk, something that you weren't accustomed to doing, just do it. And you would see, come back next month and tell us how it worked for you. And then start today, one step, one choice at a time, one faithful commitment at a time is going to be beneficial to you. So may the Lord richly bless you. I had some quiz questions. I don't know if you have the energy for that. So question, if you're doing gardening work, is that good enough? Good enough.
No,
Well,
no.
let's wait and see how much gardening work you're doing. And are you consistent with the gardening work? So gardening work can be pulling, raking, hoeing, some heavy weeds, that can give you some strength. So it's physical activity. But let's walk the garden a little bit, in the day and try and make that happen. So don't depend on the gardening alone, but do the movement. So somebody said no, but we need to sort of weigh it and see, because man's first work was in the garden. And but of course, they would have walked the Garden of Eden too. So let's try and get both. We want to get the better of both worlds. So do your gardening, plant your food, eat your nice healthy food, get your exercise too. Question, is drinking water standing on a regular basis damaging to your knees? Oh my. Uh, drink your water when you're standing, when you're walking. When I go walking, I carry a bottle of water with me. I drink before, and then sometimes I know when I come back, I'm gonna have breakfast. So I want some more hydration in the morning. So I'm gonna take my water bottle with me, and I'm drinking while I'm moving. Drink your water, you stand, sit, it's good. Your ponies will be happier because it would be lubricated. I got on the rebounder trampoline with arms swinging to the count of 40. Heel toe exercises to count on 40 and march on the count of 40, and that was good. Yeah. Great. So you mix it up within the timings. That's good, especially if you have heart issues. Please be careful with the amount of exertion that we do. Your heart just may not be able to take it. Do we have any questions? Do we have any hands up for questions? I see some microphones unmuted. Do you want to ask a question? Oh, someone was exercising during the presentation. Fantastic. Wonderful. All right, so let's see. What did you learn? Question, which of the following is considered aerobic or endurance exercise? Stretch hamstring, lifting heavy weights, brisk walking for 30 minutes, standing on one leg. Aerobic exercise. Which one of these will you consider?
The brisk walking for 30 minutes.
Very good. Nice. C. Brisk walking for 30 minutes. Excellent. All right. Next question. True or false? Sedentary behavior increases the risk even if a person exercises occasionally.
True.
True or false? Sedentary behavior increase the risk.
True.
What?
True.
Oh.
True.
All right. Wonderful. Okay, true. The answer is true because prolonged sitting, which is separate independently, increases disease and mortality risk. So we don't want the prolonged sitting. I think it's time I need to stand. Okay, last question. Name two. Give us two health conditions that regular exercise can help to prevent or improve. We talked about certain health conditions. So what are two that can either be prevented or improved? What do you think?
Type 2
Diabetes.
and
Diabetes.
hypertension.
Heart attack, cardiovascular, diabetes, cholesterol. Yeah. What else? Uh-huh. We talked about osteoporosis as well as MS. Okay, so here are they. And certain cancers, remember? Cancers. Breast cancer was there too. So ladies, when you walk, oh, your breasts need to move. Okay, let it move. You think it moving too much? Leave the breast, let them move. Because when you hold it up in a bra, that undergarment, and it's rigid, stiff, holding all day long. Poor breast. Okay, so when you're exercising, you may have something on, but again, the brisk walking will get it jiggling, moving. If you are on a rebounder, excellent. So in that way, you get a drainage of all kinds of fluids that needs to move and move toxins and waste matter out of the breast tissue. That's hugely important. So you see, exercise here helps that. And then hypertension, okay, depression. Depression is helped. So we mentioned all of those things. Very good. So thank you everyone for attending, for your active participation, and may the Lord richly bless you.
Thank you. Thank you, Dr. Nash.